So I first learned about iovera mostly through my partner. We're constantly looking at new things to help patients. We do all the kind of cutting edge things that are pain injections to help people. And what we were really looking for is what's something we can do to advance the patients to the next level.
2 years ago, I just kind of ran across iovera and did some research on it. Even though we were doing a very good job of controlling pain around the time of surgery, the first 3 to 6 weeks was still a challenge for us in terms of narcotics for our patients and refilling them and the complications associated with narcotics. So that was something that was on my mind when I started evaluating, what could we do to help with that.
Most patients just sit there and go, oh, that makes sense. It's really kind of almost common sense to them. I go, guess what? We're gonna numb up your skin and we're gonna use a little tube and we're gonna put a little ice cube on your nerve. And it's gonna basically freeze the nerve and disrupt the information to your brain about the pain you're having. And it's gonna do that for maybe 4 to 6 weeks, maybe longer, but that's gonna reduce your pain and that's what's gonna make you more successful after surgery. They've all used ice on some extremity and numbed it up and stuff, and so they get kind of an idea and no one balks at it.
We started out wanting to evaluate in a small group of patients for a period of about 2 months and see how they did first. Once we had a group of patients that really had that clinical success and we documented how much narcotics they were taking and how it helped with their pain post-operatively and how their results were over 3 weeks and 6 weeks and 3 months and how the recovery was so much easier compared to before. We said, okay, we need to expand this in a wider patient population. It's really grown since then, and this fits a very important role in the post-operative recovery.
I've had countless patients come back after the iovera and say, what'd you do different this time? And why am I getting more motion? And did you change the medication? And we're getting more patients to come back doing better early on. Dr. Kunapuli and myself do the same regimen. We do the same pain protocol. We try to give the same medication. All of it together, and especially with the iovera, it reduces their pain medication.
The results kind of spoke for themselves. We saw our patients with iovera, without iovera, in terms of how they were doing and the narcotic usage and where they were at 3 weeks and 6 weeks. If you look at the overwhelming majority of patients who have gone through the program have done this, it's been very successful.
How you implement it in your practice may be different depending on your own situation, whether that's somebody else doing it for you or whether you implement it in your own practice like we have. It's ergonomic. You can take it to your office. It can be in your office. It can be in a hospital. And we have other physicians who actually send us their patients to have the iovera done so they can get a more successful result.
Indication. The iovera system is used to destroy tissue during surgical procedures by applying freezing cold. It can also be used to produce lesions in peripheral nervous tissue by the application of cold to the selected site for the blocking of pain. It is also indicated for the relief of pain and symptoms associated with osteoarthritis of the knee for up to 90 days. The iovera system is not indicated for treatment of central nervous system tissue. The iovera system's 1x90 smart tip configuration, indicating one needle which is 90 millimeters long, can also facilitate target nerve location by conducting electrical nerve stimulation from a separate nerve stimulator. Important safety information. The iovera system should not be used in people with the following conditions: blood that thickens when patient is exposed to cold or cryoglobulinemia, blood appearing in the urine when patient is exposed to the cold or paroxysmal cold hemoglobinuria, skin rash that appears when patient is exposed to the cold or cold urticaria, narrowing of the blood vessels in the hands and feet when patient is exposed to the cold or Raynaud's disease, and open and/or infected wounds at or near the treatment site. Patients being treated with the iovera system, a needle-based therapy, may experience certain reactions, including but not limited to bruising, swelling, inflammation and/or redness, local pain and/or tenderness, and altered feeling at the site of application. Proper use of the device as described in the user guide can help reduce or prevent the following reactions. In the areas where you are treated, damage to the skin from being exposed to cold or heat, darkening or lightening of the skin, and dimples in the skin. Outside the areas where you were treated, muscles may not work or move normally. For more information, visit www.iovera.com.